Another top story today, we soon have the option not to wear masks indoors. To weigh in on this, we have former Health Secretary Dr. Paulyn Ubial. Great to have you with us this morning, Doctor. So what do you think? Is it time to make mask wearing indoors optional?
Well, in my opinion, it's still premature to do that because of certain conditions that are existing as of now. We have to have high vaccination coverage, and our booster doses are still very low at around 25%. And also, the threat of new variants has just been announced, the XBB and XBC of the Omicron. And also our positivity rate right now is still very high at around 13 to 15%. So I don't think it's safe to start thinking of making wearing masks optional.
Doctor, for you, what parameters should be met for it to be a good time to make mask wearing optional? Where would you want to see the positivity rate? Where would you want to see the vaccination rates?
Yes. Well, if DOH would put up the criteria, I think they would consider all aspects of the pandemic and not just one aspect, meaning that you have to look at the total picture and not just one area. So you have to look at vaccination rates. We have to have 80% coverage or more of primary doses and 50% of booster doses. You have to look at the healthcare facility capacity, meaning that if we have a surge of 18,000 and 1% of that is severe or critical, then that's 1,800. Can we handle that in our healthcare capacity? Then we look at the reported cases, right now it's around 1,500 to 1,700. So it's still very high. And also the evidence that show that wearing masks is actually protective. Even if it's just cloth mask, there's a level of protection. And I think there's it's not bothering anyone. It's not causing any additional, shall we say, discomfort to the public. So why lift it? And also the upcoming super spreader events like the Undas and probably the Christmas parties for upcoming Christmas celebrations.
Right. Speaking of Undas and Christmas coming up, how dangerous or safe is it to remove our masks at this point? What are the best practices? I mean, we know that it's now optional. You don't have to wear your mask. That's going to be implemented soon. But for you, Doctor, what are the best practices? How can people still keep themselves safe?
Yes, because even if we try to practice the minimum health protocols, there are still, shall we say, super spreader events. And that's usually when we remove the mask and eat together. So if you're having events like Undas or Christmas parties and you don't remove your mask or eat together, I think that would be safe because we've seen that even in our workplace in the Philippine Red Cross. If people come together and eat, that's the time that we have a surge in the positivity rate because we test regularly. But if we close the pantry, we stop people from sitting together and eating, they eat on the desk and they eat alone, then we see that really prevents the surge or increase in the number of cases in the workplace. So I think that's evidence enough, and there's CDC data and research data all around the world It's really removing the mask and sitting close together and talking or eating that spreads the virus readily.
All right. Very difficult to not get together and not eat together during Filipino family occasions. But I guess to your point, we do need to get those vaccines and those boosters in more arms. Thank you so much for your time this morning, former Health Secretary Dr. Paulyn Ubial.